Now, the U.S. Centers for Disease Control and Prevention is now changing its Ebola procedures after a nurse in the U.S. state of Texas became infected. Nina Pham was wearing protective gear while treating an Ebola patient who later died, you may remember. Well, the National Nurses Union says guidelines were constantly changing at this hospital, and, quote, there were no protocols either at that same location. CNN has asked the hospital to comment, but we've yet to hear back. Victor Blackwell reports on how Pham's case triggered these new procedures.
Good afternoon, everyone. A huge admission from the director of the CDC. In retrospect, with 2020 hindsight, we could have sent a more robust hospital infection control team. Dr. Tom Frieden says he regrets not doing more after Thomas Eric Duncan tested positive for Ebola, saying a more aggressive response may have prevented the spread of the deadly disease. Now, Frieden is hoping to contain the virus by sending a special response team to Dallas. People who are experts, leading the world in everything from laboratory science to infection control to hospital administration. And we're working hand in glove. And for the first time, we're hearing from Nina Pham, the nurse who contracted the disease while treating Duncan. In a statement released by Texas Health Presbyterian Hospital, Pham says, "I'm doing well and want to thank everyone for their kind wishes and prayers. I am blessed by the support of family and friends and to be cared for by the best team of doctors and nurses in the world here at Texas Health Presbyterian Hospital, Dallas." Now, at least 75 health workers who treated Duncan are also being monitored. Doctors say the 26-year-old nurse was wearing full protective gear.
We pray for her, for her family, for the growing faith.
Father Jeff Coy leads the parish at Our Lady of Fatima Catholic Church in nearby Fort Worth. Pham's family has attended Mass there for more than a decade. Coy has been in constant contact with Pham's mother.
When I talk to the family, and my thinking that they're doing well, they feel okay. The reason is, first, that they believe in God and they trust that that's the God's providence. They can talk via Skype and phone, so they know for sure that what happens to one another. And I think Nina and her mom are doing well.
With a sibling in California and another in San Antonio, Pham lives closest to her childhood home, Father Coy says. She graduated from the College of Nursing at nearby Texas Christian University and was a member of the Sigma Kappa sorority. Hours after the announcement of her positive test results, a university administrator sends an email to all students, faculty, and staff assuring them TCU has no reason to believe this alum has been on campus recently, and to keep her in their thoughts and prayers during this time. CDC investigators are still trying to determine exactly when Pham was exposed to the virus. Father Jim wants to know when she's coming home.
We pray that that will let her be healed soon, and we can see her again.
And I'm sure you've noticed that dog, that Cavalier King Charles Spaniel, in the pictures with Nina Pham. The dog's name is Bentley, and we understand that the dog is now in the care of the city of Dallas at a new facility. The dog could possibly have Ebola, and we understand that the dog is also being closely monitored. Victor Blackwell, CNN, Dallas.
Now, of course, the U.S. isn't the only Western nation dealing with Ebola. There are several cases in Europe. We're going to bring in our team, correspondents based there now. We've got Fred Pleitgen, you see there closest to me. He's in Berlin. Al Goodman is following developments out of Madrid. Good to see you both. Fred, let's go ahead and begin with you. I understand Germany has, I think, 3 Ebola cases. So what's the story behind the UN worker who was from Sudan who passed away, and the other, I guess, aid worker who's being treated right now? What do we know about how they came to be in Germany and what's up with them?
Yeah, good morning, Errol. Germany has one patient that is currently caring for. That's in the clinic in Frankfurt. That patient came here on the 3rd of October. It's unclear how that patient is doing at this point. Then, there was one person who was being treated in Hamburg, but that person actually became better, and they were able to release him from hospital. And then, of course, you have the case of the 56-year-old UN aid worker who is Sudanese, but who was infected in the Ebola zone in Sierra Leone, and was then brought to the clinic in Leipzig. What we know about him is that when he was brought here to Germany last Thursday, he was already very much in critical condition. However,